Socks are the #1 most requested item at homeless shelters. Underwear second, and shirts are third. At Bombas, socks were first, made with comfortable details for everyday wearing. Then underwear, and shirts too, all designed to perfectly fit. At Bombas, every item you purchase means you're donating an essential clothing item to someone in need. One comfortable clothing item for you, one donated to someone in need. Bombas, comfort for all. Get 20% off your purchase at bombas.com/comfy.
Girls, we want to meet you where you are. Welcome to the Dare to Ask podcast. Episode 3, Kids Take It to Heart.
They let me in such a vulnerable period. We develop a pretty special relationship.
I'm Cori Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Cori Jensen and sponsored by Essentia Health.
Wait a second, I am a doctor.
My guest and featured provider today is female in a male-dominated competitive specialty field of pediatric cardiology. She's a mom to 2 under 5, a wife, and a woman who has deep compassion and connection with her patients, but also with her patients' families. My talk with Dr. Rauser-Foltz surprised me. She got very personal about her journey into motherhood and how that has directly shaped her in her own practice. We're going to talk about how scary it is for parents of her younger patients, and she'll give insight on the one thing she really wishes that all parents would stop doing when it comes to their kids' health. We're also going to talk about the hardest thing she has to say to parents that almost always makes them cry. We knew talking matters of the heart might be challenging, but I can promise you that Dr. Rauser-Foltz will have you hopeful about the future. Regifting. Do you do it?
I don't regift.
Do you think it's tacky?
Maybe under certain circumstances.
Yeah.
It can be okay if it's a good fit for somebody. Like, hey, this wasn't really for me, but...
Right. The premise,
Yeah.
right? Favorite comfort food? Mac and cheese. Are you homemade or are you good with the Kraft from the box?
Maybe a little bit of a snob, but I prefer Panera.
I married a snob who will not touch a boxed mac and cheese. It has to be good cheese and like good quality noodle.
Yep. Yeah. My kids love Kraft, of course.
What kid doesn't?
Yeah.
If you had a time machine and you could stop at any age, what was the age that you could repeat?
Probably like 17 or 18.
Yeah.
Still in high school. 0 responsibilities.
No bills.
Yeah. Right. Still living under mom and dad's roof. Had a part-time job, so you still had some fun money. Yeah. But once you get into college, things get a little more serious and you have more responsibilities.
And especially for you, because to become a pediatric cardiologist, it takes a heck of a lot of education and time. If I were going off of The Voice and blind auditions, we've just met. You are a young woman, so I'm assuming you had to know you wanted to go into medicine at a pretty young age.
I had an early interest even in high school.
Really?
Certainly I didn't know that I was going to become a pediatric cardiologist in high school, but I loved biology. I loved learning about how things worked. And so I entered college with the idea of I'm going to do pre-med. So many people change their minds in college.
Right.
But I stuck with it and I worked in the hospital as a nurse's aide, so I got more exposure. I kind of worked my way up in the hospital as much as I could without a degree. So I moved to the lab to work as a phlebotomist just to get more exposure, and then eventually ended up in cardiology. And I think that kind of sprung my initial interest in cardiology.
It wasn't 5-year-old little girl in kindergarten saying, I'm going to be a doctor when I grow up.
Well, I think it was 2nd or 3rd grade. it was career day. And I was a pediatrician. But really, I had nobody in my family was a doctor. And so it's hard for me to actually pinpoint why I had that thought so early on.
And you had encouragement along the way. Usually helps mold kids so much.
Yes.
I'm so glad you're in here to talk today. Pediatric cardiology. This is an important job for our littles, but also overall health. How competitive is this field?
Pediatric cardiology is one of the most competitive fields within pediatrics.
Okay.
So just a little bit of background of how I got to where I am today. So, I did my undergrad degree, then I do 4 years of medical school. After medical school, we have to decide our specialty. I went into pediatrics. And then once you're in pediatrics, that's when you decide, am I going to be a general pediatrician or am I going to go on and be a subspecialist? The field of pediatrics itself isn't that competitive, but once you get into the subspecialties, cardiology is one of the most competitive specialties. And I think we're going to see an increased demand for cardiologists as we start to see the older population start to retire.
Yep. Why is there more need? Is there more heart problems in our kids these days?
I think it's a little bit tough. So we know about 1 in 100, 1 out of 100 children will be born with a heart defect. And so the prevalence is actually higher than the lay population thinks.
For sure.
Really what we're seeing is that these kids are now growing into young adults. And before we didn't have good management options for these children, and so we didn't see them, unfortunately, live that long. So I think where the greatest need is actually caring for adults who are born with heart problems.
Oh, wow.
Not necessarily children. Today, we have more adults who are born who have congenital heart disease than we have children.
You can find out in utero through so many of the great tests that we now have for our fetal care. And you already have like a billion fears, right? As a new parent who wants to have a baby.
Without a doubt.
Without a doubt. And then you find out your infant who hasn't even been born yet, we already know there's some sort of heart condition going on. Is that, though, intervention the best? Learning that soon?
There's a lot of advantage to knowing early on for many reasons. So one, I think it allows you to prepare as a family. What does this mean for our future? Not only that, knowing early on, with us living in the community we live in, we don't have a pediatric cardiac intensive care unit. And so for many of my patients, it means that we need to translocate the family or specifically the mom to a higher level of care before that baby is born. And that's for a few reasons. One, I hate the idea of separating mom and baby immediately after birth, right? Imagine.
No, I don't even want to imagine. Right,
mom's had a C-section. She's recovering from that. We identify a cardiac anomaly in baby, and baby has to be flown to Minnesota. Having a baby and recovering from a surgery like that or a labor is hard enough on a mom, and then to separate a family. And then we also have to think about the rest of the family dynamics. Oftentimes there's other children involved. You may not have a family support system to care for those other children. And so I think early identification is critical just for planning purposes. And then also just mentally, to prepare for that.
Isn't that so huge too? There is a lot of that preparation that happens. As an anxious new parent, you're like, oh, I just wish the baby would be here tomorrow. But part of the baby's growth is also doing a really huge work on mom's brain and heart too, and dad's as well in that 9 months. So one of the big myths would be, you've identified that there's a cardiac anomaly in my fetus. Is my baby going to live? Is simply the diagnosis a death sentence? Probably the number one fear, right?
Yeah, it depends. It depends what we identify. Some things are very simple, and sometimes we don't even need to intervene on things. We will often find small holes in the heart that will close on their own. That's simple for me to answer that. But oftentimes we have patients with complex heart disease, and we get a lot of information when we do the fetal scans, but sometimes we need more information after baby is born.
Because they really are developing still in there.
You got it.
test again in a month and resolutions have already been had.
Yeah. I try to counsel the families that regardless of what this outcome is we're going to do what's best for the baby and what's best for your family. And we're going to support you in your journey. Yeah. And so while I might not have the answer for you today, I just try to provide that support to them.
Just because of that, the gravity of what you deal with every single day, it can be very heavy, not just on your families, but also you as a person. You are a young woman who cares about her patients, but also as a mother herself.
I think that being a mom really allows me to connect better with my families.
Yeah.
I started my medical journey not being a parent, and I was in pediatrics, so I was giving parenting advice, and looking back on it, it's like, oh, really?
I'm sure it was still good advice, but I know perspective is everything, isn't it?
Definitely. Oh, well, you're trying to sleep train, just put them back to bed.
Right.
Don't talk to them. Just put them back to bed and walk away. It's not that easy.
Right.
But not only that is knowing how the mother feels. And I think one of the most important things that I say when I'm having these tough conversations is nothing that you did caused this.
Yeah.
They need to hear that.
Is that hard for you to say? Or is that one of your biggest challenges as their doctor?
It can be because the moms always cry.
Of course.
I always make them cry. And usually it's after I've said these really hard things, I tell them that I'm going to tell you the most important thing of this discussion today. And it's that nothing that you did or didn't do caused this. So it's hard, but they need to hear it. Otherwise, if I let them leave the room without saying that, they're going to go back and think, gosh, did I miss a prenatal vitamin? Right. Or, I didn't know I was pregnant and I had a glass of wine. Did that cause this?
Yeah.
So they need to hear it.
You needed to hear it when you were pregnant too.
Oh, yeah. My first pregnancy was tough.
Will you tell me a little bit more about that? Tell me about your family and your
Sure.
kids.
I have 2 wonderful girls. Oldest just turned 4, and my youngest is about 2.5, not quite. So really busy ages.
Yes.
We try to plan our family. I'm a type A personality, recognizing the path that I was on. I got married in medical school. I knew I was going on to residency, and we tried very hard to plan our family, and that was a joke. Can't plan that. Ultimately, it took us a long time to have kids, almost 5 years. And then I decided, I'm going to stop trying to plan this. I'm getting older, and so I had my first child. I was about 6 months into my first year of fellowship. So
you were in your early 30s when you started having kids.
Yes.
So for sure not young, but also not old.
Right.
Now, was your family planning because you said it did take a little bit of time? Did you have any intervention? Were you confident that this is just still timing?
Well, we're going to get a little deep here. I was successful at getting pregnant, but not maintaining those pregnancies. And so we did have to seek help for that reason. So I underwent test after test after test. Nothing was identified. And so we saw a specialist. And then with my 4th pregnancy was my first successful pregnancy. And so with that intervention, we were able to be successful with that.
Thank you for sharing that.
You're welcome. That's something I do often, but I think it's important to talk about, though.
I do too. Put this in a category of taboo, and it's not. I mean, if 1 in 4 of us are going to have a miscarriage or have had a miscarriage, we're not alone. Should it be first blush that we automatically assume that that person's life has been all roses and they've successfully had a handful of kids? It's not always the case.
I hid my miscarriages. I didn't talk about it. People didn't know what was going on in my life. In retrospect, I wish that I would have been more vocal about it, because why not reach out to your support system and let people know that you're suffering? There's no reason for it to be taboo.
What I've learned in my loss and success journeys has been validation. For me, I've had miscarriage. I've had a stillborn. I stand behind a loss is a loss is a loss. When you're a parent, you're a mom. Every child matters. It's truly a mission of mine to be talking more about this stuff, just to know that even simply knowing that I've known you've been through this, I just already feel such a connection and a bond. The life experience you pick up in that too. Having your first successful pregnancy. Tell me then, when did you finally feel comfortable sharing the news? If you've had 3 losses before, I can imagine your nerves.
Yeah. I had to tell people early on because here I was starting cardiology training and we're in the cath lab, we're exposed to radiation and I've already had 3 losses and boy, I'm going to do everything that I can to try to sustain this pregnancy. So I had to tell the cardiologist I was working with and they really graciously changed my schedule around and said, okay, we're going to keep you out of the cath lab until you're done with your pregnancy, which I'm so grateful for.
Right.
So my work family knew about it fairly early on. And I think I shared with a lot of my closest family and friends. Our family knew immediately.
Yeah.
I think what was different is that it took me a while to celebrate the pregnancy.
Yeah.
I mean, I was probably 7 months along or so before I actually prepared the nursery or even bought anything because I just didn't want to be disappointed.
Yeah.
So it took me a long time to embrace the pregnancy. And then there was a constant fear. And I don't think that fear actually left me until I had my second child, actually, because work in pediatrics.
In your field, you see...
I see the badness.
And badness and death regularly. So
Yeah. So I was constantly waiting for something bad to happen. Was I going to feel a mass in her abdomen and, was she going to have cancer? It was just waiting for badness. Yeah. Now she's a healthy 4-year-old.
Thank you. Explaining and being vulnerable with us. Did you say your first pregnancy was difficult?
I had gestational diabetes with her. It was fairly unexpected. So that was a bit of a struggle. And then because of that, I had extra scans looking for her to be too big. So babies get too big when we have extra glucose around. And I found out that she was too small.
Oh, wow.
And so then I was seeing the maternal fetal medicine specialist, so the high-risk pregnancy specialist, and having frequent scans. And the plan was for me to deliver early because she wasn't growing at the rate that she should have.
Yep.
I was thinking about this the other day. I had a really great maternal fetal medicine doctor, and then he was out one day, so I had to see somebody else. And this guy was telling me that the baby wasn't growing because I wasn't eating enough.
Oh, no.
So then, of course, I believed him, but I knew I was eating fine, and it was hard enough to have gestational diabetes, and then still in training. I'm working 80 to 100 hours a week, so my life is hard enough. And then my next visit, I talked to the next doctor, and he's like, this is not your fault. This is your placenta. You have nothing to do with this. So just an example of trying to place blame on a patient, right? It does nobody any good.
But look at how you've taken a genuine personal experience in your own health and your baby's health, and you've been able to shape that in how you practice medicine with your own patients.
Right.
Words do matter. This is our child's life. So we take in all of that, and it means something to us.
Right. Yeah, and I try to remind myself that, boy, I come to work and I do this every day. This is my everyday. But it's not the family's everyday, right? This is scary. They're going to see the cardiologist because somebody thinks there's something wrong with their child's heart. So I try to remind myself of that because I think it's really easy to get in the grind of, okay, here's just another patient. But really, it's a family who's scared.
You sharing that just reminds me why we even wanted to start and create this podcast. It's humanizing the providers that we put so much trust into. Before you open that door, you're already thinking, this isn't another number. This isn't another chart I'm checking off my list, but this is a family. These are people. Things I say matter. The advice I give matters. Having a good relationship with your patients. It's one of the reasons why I've long said, Essentia, I'm a fangirl. I have a girl crush on so many of the providers because they all do such a wonderful job in making me feel warm, listened to, invited, and it's important across all areas of medicine too.
Well, thank you for sharing that. It really is an honor and a privilege to work for Essentia. I feel like I hit the jackpot when I got this job.
Now, you are a North Dakota girl too. Okay. How did North Dakota girl, you went out for education as well and residency, all of that. Will you share with me that journey a little bit?
Sure. So I'm from Bismarck. I moved to Grand Forks for schooling, and I did my medical school in Grand Forks, and then did my pediatric residency, and there's no program in the state, so I had to leave, and I moved to Omaha, where I did my pediatric residency.
Okay.
I was really fortunate to join a residency program that had a really thriving and robust cardiac program, and so I was able to stay in Omaha. So I completed 6 years of training in Omaha, and then I started looking for a job. I found out from one of my friends who's an Essentia employee, hey, did you know we're looking for a pediatric cardiologist? I was like, what? No. So I applied, and here we are.
Oh, my goodness. Now, your husband, where is he from? Because you met in college, or was it residency?
We met in college. He's from Grand Forks.
Okay.
And so Fargo is really central for us. It was hard being in Omaha, having 2 kids without any family support.
Absolutely. So as a young woman who is a mom in this field that, from my understanding, pediatric cardiology is a very male-dominant field.
Correct.
I'm curious as to what that looks like for you on a daily basis. Is that difficult? Is that hard? Did you have a mentor? Who did you look to? Or are you a true trailblazer?
Well, I am fortunate to have been in a training program with other female training partners who were also females with children. Mm-hmm. And we really bonded, and they're still some of my best friends today. Yeah. And we were relatable. Mm-hmm. We were in a training program that was very intense, and we were pregnant or breastfeeding or going home to kids. Mm-hmm. And so we could relate, and we could lean on one another. Right. And it was really important. I think it would have been hard to be successful without them.
We need a support system. Whether it is a direct mentor, we need the support. We absolutely do. Do you encourage other women in medicine to come with you, come alongside me?
Absolutely. Things are changing. Mm-hmm. My medical school class was 2/3 women.
Really?
Yes. And there's no reason why women can't be successful in my field. Mm-hmm. And looking back, if I can have 2 kids during a 3-year training program and be successful, why can't any woman do that?
You've painted such a great poster for you can do this.
It's hard. Without a doubt, it's hard. And I really attribute a lot of my success to my husband.
Yeah.
He quit his job to raise our kids when I was in training. It would have been a lot harder to do that if he had not made that sacrifice.
Yeah. Brings on some of the strongest partnerships, too, is sacrifice. Spoiler alert, sacrifice happens for healthy marriages.
Absolutely.
Now that you have been at Essentia here in Fargo and you practice on 32nd Avenue at the big Essentia Hospital.
Okay. So I'm approaching 2 years.
Yeah. So you had your babies, you come back, and you find this wonderful position that you feel very fortunate in. Best part of your job?
Building relationships with families. You know, they let me in such a vulnerable period. Through that, I think we develop a pretty special relationship. I see my patients fairly frequently, and children who are born with heart problems, they need lifelong cardiac care.
Yeah.
So it's a lasting relationship.
That is kind of a beautiful privilege to be able to have.
Without a doubt.
When we talk myths, is there anything that you wish more people would just call and ask their doctor about, or maybe turning to the internet?
So I think it's so easy to have a visit and then go home and Google your symptoms or Google what does this mean. And I just encourage my families, I assume they're going to do that. Most people will. So I say, when you go home and when you Google this, you are going to read things that differ from what we just spoke about. Please contact me so we can discuss it. It's my job to educate, and it's my job to teach you so you understand. It's not your job to figure this out.
Heart disease is incredibly prevalent in the world. Everybody has I know somebody who, and here's your unsolicited advice. It's dangerous to accept that advice is what your experience or your family's experience is going to be.
Yes.
So to be able to turn to your provider is so key. And isn't it great with technology these days and the app and MyChart? I mean, I genuinely love being able to, if I have a question, I don't have to wait till my next appointment.
It's so simple.
It's so simple.
And I think it's a good avenue to say, okay, can this wait? Or do we need to come in and revisit this?
Yeah. Because our podcast is women-centered, complete bonus that I have a super intelligent female who's practicing medicine. But just from woman to woman, there are practice that you do in your daily life that you think is overall good for your health.
I think it's very easy for us to get wrapped up in life. And I think every day you need to take time for yourself. And it doesn't have to be a lot of time. Some days for me, it's taking a shower without interruption.
Right.
It's easy to forget the importance of taking care of ourselves. And so even just having a few minutes of peace, even to gather your thoughts, or having a hobby, I think it's important to have something outside of work, outside of your family that you do for yourself.
It's usually the first thing that goes when life gets stressed, and especially when you're raising littles. That mommy self-time, even the 5 minutes a day, that can go to the bottom of the list.
Right.
Our makeup is to sacrifice ourselves.
Isn't that true?
It is 100% true, but literally taking that time for yourself. I so agree.
More importantly is not feeling guilty about it.
It's ingrained in us. We do that. We just feel guilty that we're to blame for whatever.
Why?
I don't know. Is there one thing that you would also want other women to know, or families that might be facing a child with some sort of heart condition?
It's easy for families to think, I need to hold my child back, especially when it comes to physical activity. You know, often I'll have a child come into the office because they have a heart murmur, and nothing's been diagnosed, but the families will tell me, well, I've pulled them out of gym. Well, probably not necessary, because that then creates anxiety for the family. The caregivers are worried about the child. Or when I have a child who has complex heart disease and they've had multiple surgeries, the families will pull them back. And kids are really good at restricting themselves. When they're tired, they're going to take a breather. Let them do that. Let them play. Let them work hard. And some of the most complex heart disease we have, exercise is encouraged. From a heart perspective, that's what I would say is just because your child's had heart surgery doesn't mean that they can't perform physical activity. There's very few cardiac reasons that we tell kids they can't exercise.
Depending on where they're at in treatment, we want to just protect our kids. We want to keep them from all bad things. But unfortunately, sometimes when we get out of our comfort zone, we grow, and it's healthy for us. So we could be doing a detriment to them by pulling them out of things. It's a really good piece of advice. Your passion, your field, pediatric cardiologist. You sharing is huge to me. Thank you so much for coming in and joining me today.
This is fun.
I hope to have you back.
Yes, I'm happy to come back.
I have such respect for Dr. Rauser-Foltz and what she's able to provide to patients as well as their families. Looking ahead to the next episode, I'm super excited to get into midwifery with you. Since I'm a mom to a huge family, I tell you, I love a good birth story. I love women empowerment. And I love just really positive, good people. So next week's guest really is someone very special. Midwife Jennifer Janke from Essentia Health. I'm excited for you guys to fall in love with Jen like I have. Get into some midwifery myths too, because there's still a lot that surrounds that field, and we're going to talk about it on the next Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Want to know the secret to a great night's sleep?
I'm listening.
It's the GelFlex Grid, and only Purple mattresses have it. It's made from a hyper-elastic polymer that instantly responds to your body. The GelFlex Grid is why Purple mattresses are soft where you want it and firm where you need it.
Wow. Tell me more.
It flexes around pressure points, keeping you supremely comfortable. Plus, the GelFlex Grid has over 1,400 air channels that let hot air flow away from your body, so you sleep sweetly through the night. Learn more at Purple.com. More at Purple.com. More at